Poso maoni wiak, waiwanan kitana ni mua, yoski piataya posnotaman yum MITW Podcast. Yospis piataya posnapi notaman, and hisikimaka yoso matnamin kihi.
Welcome to the Menominee Indian Tribal Wisconsin podcast. I'm your host, Sheena Wapus. On this episode, I'm again joined by guest Vaughn Bowles, and he is the Public Information Officer for the Incident Command Center for the Menominee Indian Tribal Wisconsin, and he is here to answer some of our COVID-19 questions. Welcome.
Hey, Sheena. Thanks for having me back.
So, this was just released maybe half an hour before we were recording this. MTL, Menominee Tribal Legislature, has approved the Emergency Food Relief Assistance Payment. Can you just give us a brief description of what that is, Vaughn?
Yeah, so due to the rising costs of food and some of the economic hardship this may have placed on tribal members, the tribal legislature approved emergency funds to be distributed to all adult enrolled members of the tribe. So it's individuals that are enrolled over 18. They'll be mailing them a check. The dollar amount at present, they believe to be $400. So if you'd like to receive this, make sure you have, all of your contact information, your mailing address, phone numbers, and whatnot updated with the enrollment department. And if you have additional questions, you can go to the tribe's website or the tribe's Facebook page, and they'll be posting more information about it as it develops.
Great, thank you. So for our first question, I have asked Vaughn, what is T-cell immunity and how does it differ from antibodies?
Okay, so I'm gonna crutch and preface this whole statement with I'm not an immunologist or a rheumatologist or an allergist. That said, this is kind of how the immune system works in a very, very small nutshell because it's kind of complicated. So the body has two phases for immune response. One's fast, one's slow. The T cells are more involved with the fast reaction. T cells are part of your white blood cells. They basically rove around through your body at all times. They have different receptors on them. They can identify something called MLH, not MLH. MLH is different. HLA, or human leukocyte antigen. Basically says each one of your cells belongs in your body and it's healthy and it's performing its functions as it should. So the T cells and another set of cells called macrophages rove around the body looking for these antigens, making sure everything's functioning properly. So in the event that a bacteria or a virus gets into one of those cells, the cell stops producing the HLA. And so either the cell is attacked by a macrophage or a T cell. There are two types of T cells, actually. One's called a killer T cell, the other's called a helper T cell. A killer T cell will actually attach to a cell that's been infected, and they'll destroy the cell, essentially. What that'll do is that'll trigger a response from helper T cells. Mm-hmm. And those will trigger a hormone cascade called interleukins. What these do is they stimulate B cells. B cells start making antibodies. In the meantime, your T cells will also trigger an increased production of those specific types of T cells because viruses are very small and specific, and so your body ramps up making more of those specific T cells so they can recognize the antigens or the small particles of the virus or bacteria that are present, so it can destroy those pieces of the virus in the body.
Okay.
Does that make sense? Okay. Oh wait.
It does make sense.
Here's how it differs. Here's how it differs from antibodies. Antibodies, those things that are made by B cells, they're essentially a Y-shaped protein that float through the bloodstream. They're a water-soluble protein, which isn't very common. What those do is those have receptors on the ends that bind to pathogens, whether they're viruses or bacteria, again, and they prevent them from entering a cell so it doesn't get infected. So they'll create a big cluster around any sort of pathogen, and they'll slow its progress down. That'll allow time for things like those macrophages to come in, basically eat and digest the bacteria or the virus, and that's how they differ. When you get like a vaccine or a shot, that'll actually provide pieces or those antigens of those viruses and stuff for your body to recognize those, and it helps trigger a response that ensures that your body makes more T cells with those specific antigen receptors on them and stuff, so they can recognize that specific virus when it comes in, and it can destroy it. All right, so just in summary, a T cell immune response destroys cells that have been infected, while an antibody response immobilizes pathogens or objects that'll make your body sick and prevents them from infecting new cells.
Okay. Because the reason why how I even came up with that question is I was reading an article that was talking about how someone may not have the antibody, like they're tested for antibodies and they don't have that, but they may have T cell immunity. I don't know. Does that make sense?
If they don't have antibodies, it just means that they haven't entered their second phase of their immune system. The T cells work in the first phase for the most part. Antibodies are kind of a long-term precaution that the body does, and it'll keep producing those usually for an extended period of time to make sure that if you do face that disease again, cold, virus, flu, whatever, it'll be able to ramp up its response a lot faster than the first time. So when you get sick the first time around, you got to wait around for your T cells to move through either the bloodstream or the lymphatic system to catch the virus or whatever's causing the disease. The second time around, you have more antibodies in the bloodstream, and those can clump and trigger the response a whole lot faster the second time you're introduced to it.
So what changes are happening with services at Menominee Tribal Clinic?
So the clinic is ramping back up, and when I say ramping back up, it just means they're opening up. It's not going to be big or fast or anything like that, but they are going to be seeing more patients in the medical department, the dental department. If you have issues with your glasses, they'll be seeing more people in optometry. And behavioral health is going to start seeing more patients in person again. In addition to that, the clinic is going to continue nutrition and diabetes education, and they'll be opening the WIC services back up. Aside from that, there's still going to be a lot of precautions in place. The patients are still going to need to wear masks whenever they're in the building. Even when you go back to your room, please don't take your mask off. Wear your mask the entire time, unless the doctor or nurse specifically asks you to remove it so they can, examine, your mouth or throat or nose, whatever. You're supposed to wear it in there. In addition to that, temperatures are going to be checked for all patients or all individuals coming into the building. If you have a fever, you're going to go straight over to the COVID section for a test there. We'll also have, little stickers to remind people to keep, a 6-foot social distance when they're at the registration desks, at the pharmacy or the lab. And we're also asking that adults that can come on their own do so. And if you do need assistance, only bring one adult to assist you as well. If you have a child coming in for a visit, please bring just that child who's being seen and just come in as the parent to help them. Please don't bring everyone. That increases everybody's risk to exposure, and we want to keep that as low as possible. Additionally, the pharmacy is going to continue doing the curbside service for the medication refills. And you'll see all the employees wearing masks. Some will also have goggles and face shields as they move through the building. So those are things that we need to keep in mind. So we're trying to keep COVID out of the clinic as much as possible.
I'll just give my experience. They called me, and I had originally had a dental cleaning scheduled, and that was canceled. They called me, rescheduled it for this week. So I came in, basically they took my temperature, asked me a couple questions about symptoms or traveling. And that was before I even registered. That's just when you first walk into the building.
Absolutely. And that's
And
just precautionary. Yep.
Yep. Then you register as you would normally. And I was asked, I think, maybe like 3 times, kind of the same questions, but it was okay because I understand that they're being careful, extra careful about people. So yeah, and I was wearing a mask all the way until I was laying in the chair.
Thank you.
And then I was able to take my mask off. Obviously, I had to do that for teeth cleaning, but
yeah, hard to clean the teeth through the mask for some reason. We're working on that too. Not really, totally kidding.
Okay, so the tribe is going forward with what they call phase 2 of reopening, as far as bringing employees back, which we had talked about on this podcast previously.
Right.
And can you talk about what the tribe was looking for in order to go ahead with further reopening?
So what they're basing the changes on the phase and the reopening process on is the number of active positive cases. Particularly, we're looking at Menominee, Shawano counties and stuff, since that's where the majority of the tribal members live. Moving from phase 1 to phase 2, we wanted to make sure that there was 10% of the active cases tested were positive or less, and so we've reached that point. Even though there's an increasing number of cases, part of that is due to the increased testing available, but because those cases being tested aren't positive, we're moving forward with the second phase.
Got you. So I had read yesterday actually that Wisconsin as a state has reached a 2-week high for positive cases, and I was wondering what type of triggers would it take for the tribe to go further into restrictive lockdown?
So again, it's based on the testing numbers. That's the best metric we have right now. So if we see that we're testing 100 people a week and 15 of those come out with positive cases, we'll go back and revert to a phase 1 setting where we're closing more of the buildings down, and starting the remote work again. The phases at this point are a pretty fluid thing, so it's not like, all right, we've reached phase 2, hooray for our side, we're going to continue onward at this pace. The incident command team and the tribal legislature understand that the process is going to be ongoing. We may need to pull back for a while, and that's why we've set those limits. If we reach a point where less than 5% of those tests are active cases, we'll move up to a phase 3. If not, we'll stay in phase 2 for a while. But right now we're kind of trying to conduct business as best we can, at as safe a level as we feel right now. So.
Okay, so I've been seeing more questions regarding the tribe opening up public buildings, in particular places like the rec center. Are there plans to open public buildings soon?
So that's the phase 3 thing, and we'd love to say yes, this is the solid date, we're going to open it all. But again, we're basing it off that testing and stuff. If if it's still spreading through the community and we don't feel it'll be safe to open up those areas, especially because it's difficult to clean areas with high volumes of the public coming in and out. And so right now, those aren't going to be opened. Hopefully, we'll find that due to precautions that the community takes, that there'll be a lower number soon, and we'll be able to open those sooner. On the flip side, you did ask about parks at one point.
Yeah.
And the parks are all open again.
They are open. Okay.
They are all open again. Yay for our side. I was talking with Crystal Chapman, who's the head of community development. She says they are all open at this time, but she's also extremely short-staffed. She has about 10% of her regular staff on hand. So if you go to the parks, please try your best to help maintain the cleanliness of the park. If you see some litter, please pick it up. Keep the area clean for everyone else as well.
Okay, cool. My mom is actually here right now, so she handed me a Post-it note while we're talking.
Perfect. I love it.
The
I love
question.
it. Thanks, Mom.
I don't know, something about how it's being blamed on COVID, but it's other viruses. Is there any truth to that?
So they have Sort of. I'm going to give you a
Okay.
sort of
Okay.
on that. So there have been cases where people have they've died and they've considered a COVID death, but it's kind of skewed the numbers a little bit, because there are people that are, in their 90s, they've caught COVID, but then they have a heart attack, and in some cases they've counted those still as a COVID death, even though there are comorbidities leading up to that point. And in some states, I believe Colorado was the first one. They've actually gone back to look at the number of COVID deaths they've had, and they've been revising it, and they've found that about 25 to 30% of the cases, the deaths weren't actually caused by COVID-19. It was actually underlying conditions that led to the death. And there was even one case where I believe someone died in it's like a fall or a skiing accident or something like that, and they had COVID-19, so they counted it as a COVID death. Well, if you fall and break your neck, that was a much more immediate threat to you than the virus.
Right. Yeah.
And so they are going back and they are looking at some of those numbers. One of the things that has been kind of pushed aside were deaths caused by the common flu this year, and so they're going back through records and medical charts, and they're trying to weed out now in places which deaths were actually caused by COVID versus cold virus or other conditions. So there are cases where the numbers have found to be a little overinflated. And they're trying to correct that now.
Yeah, I gotcha. Okay. Is there any last message you want to let people know?
The tribe isn't fully open right now, and we really appreciate your patience in working with us and trying to keep the community healthy. I know there have been questions about what it's going to look like when business opens back up. One of the things that the tribe has really gone out to make sure everyone's healthy is that they've gone and they've purchased, I think it's 74 temperature kiosks. So whenever you come into one of the tribal buildings, there'll be a unit there to check your temperature and stuff. If you're over and experiencing any symptoms, please turn around and go home. Contact your medical professional and stuff. In areas with waiting rooms and whatnot, there'll be more plexiglass up between reception areas or receptionists and participants and customers. There'll be more face masks. More virtual meetings will be used. I know one of the things we've talked about doing is having more of the workers work remotely long term, and that's to help maintain the social distancing. So those might be changes. Things might be a little different going forward than we've been used to, but we really appreciate everyone taking the time to help ensure that everyone stays safe and healthy in the community. So there will be some differences, and we really appreciate your help, maintaining that standard of health that we've kept here so long.
Great. Okay, thanks, Vaughn.
You bet.
Waiwanan for listening to the Menominee Indian Tribal Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab, and keep up to date by following us on Facebook at MITW Podcast. We are aiming to do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them to us via email at podcast@mitw.org.